Hey everybody, I'm Dr. Tammy. Welcome to tonight's live. This is a interesting conversation tonight, so please bring your questions. It's all about you if you have questions, but of course I always have a topic outline for you. And tonight we are talking about something that people don't usually want to talk about because just like menopause, menstruation, hormone changes, it's all taboo and we just don't talk about that, right? And especially anything to do vaginally. And so it is time that we have the conversation because almost 90% of women suffer with some sort of issues because of hormonal changes. And that can be anything from bladder changes, urinary tract infections, even trouble with pregnancy because when the pH and the flora are off in the vaginal area, it's just a recipe for disaster. And one of the saddest things to me is that when you look at everything that is in the nursing home, what is the number one thing that you see or smell when you walk in the nursing home? Everybody knows that. And it is the urine smell, right? And that doesn't have to be that way because everybody says that's just aging, but we know that aging is just hormone decline. So again, it doesn't have to be that way. And that is my mission, to change that messaging, because what we see in the nursing home is the end point of the disaster of women not being able to regulate their hormones. So one of the things that happens in the nursing home, and the reason the urine smell is so strong, is because of dehydration. So a lot of those people just aren't hydrating during the day well. But then what happens when you hydrate? Now you have to urinate more. And what happens when you have to urinate more? More risk of incontinence, right? And there's more cleanup. So, and then one of the things that happens is most elderly people in the nursing home are on lots of different medications. And what happens when you're on lots of different medications, that can increase vaginal dryness, urinary tract dryness, and all of the collagen that's needed to have a healthy flora in the bladder and the vaginal area. So I think it's fascinating that we have normalized incontinence because it is estimated that about 40% of women 5 to 10 years out from menopause will struggle with some degree of incontinence. And we just kind of think it's funny because if someone jumps on a trampoline with their kids or grandkids, or if you just, every once in a while when you laugh or sneeze, a little bit leaks, and we just say that's normal, right? And I just think it's crazy that when you watch commercials or you're watching TV, which I don't watch much TV, but there are so many commercials. I'm just blown away by how they make pads and incontinence underwear and stuff pretty with flowers, and they're like advertising it like, hey, it's just a normal part of aging, and if it's going to be a normal part of aging, then at least you can have pretty ones, right? And it's nuts. And I'm going to flip it. Thank you. Let's see, Amir. Okay, thanks for telling me. My screen was backwards. So I'm gonna dig in here in just a minute, but I have to have a little bit of my rant about what we have included in the messaging about aging. And I have patients tell me all the time, I know I'm just getting older, but something brings them in, and it's usually they're not talking about incontinence or vaginal dryness. They are talking about fatigue or weight gain, and very low on the totem pole is hot flashes, because that's just such a small part of what happens after you go through menopause. So I think it's very important that we have the conversation. If you know someone that could benefit from this, please do the share button right now. It's the little kind of side arrow there at the bottom, and there's lots of people that could benefit from this conversation. And there's no way in an hour that I have time to go through everything, but I hope that you guys learned some new stuff that you didn't know before. And I hope I freak you out a little bit with content that is like, I always say it's clown world, because it's just like, what the heck? Why are we doing it that way? And why are we telling people that all this is a normal part of aging because aging is just hormone decline. And when you talk about aging, everything that you see that we call aging is bone density is dropping. And so that's from hormone decline. And then we see the skin aging and the heart aging and the muscles aging, and we lose muscle tone. We gain weight because all of the hormones are out of balance. And so all of that is fixable, and you can fix it completely safely and have a great quality of life. The scary thing is all of this can lead to very dangerous things. And, when I'm talking about HRT or hormone therapy, yes, I mean, that all leads to heart disease and all the things that if you don't protect yourself and get on some form of HRT, and I'm going to explain why it's important and that you've been lied to about the safety. But even something simple like vaginal dryness that leads to infections, because a kidney infection can kill somebody. I mean, we don't think about it like that. You think it's just a little bladder infection, but the bladder can lead up to the kidneys. And so it can be life-threatening, especially if you're immune compromised or if you're, quote, elderly because you haven't had hormones. So I want to start, before I do this, I want to start with a crazy little story. And whenever I tell this, I always want to say, I don't think that we are dogs, but I just want to let people know that dogs and cats can get all the same diseases and they go through all the same processes that we go through. And my aunt, when I was a kid, had a cat with diabetes. And so if you have an animal that has had diabetes or heart disease or cancer or something, you can put that in the chat because, I think some people don't realize that animals get human diseases, and that's why they do studies on animals like dogs and stuff like that, because they are so similar as mammals. So I have a friend who raises Great Danes, and one day, one of her Great Danes, now, if you know Great Danes, they are very great. They're very big. And the dog was getting, quote, older, and she was urinating all over the house. And a Great Dane is almost the size of a human, right? So when she would pee, it was a very large puddle, smelly, and just, not pleasant. And so that's kind of the point where they're so old and they're so problematic that you even start thinking about putting them down. And so, anyway, takes her dog to the vet. And do you know what the vet did to fix it? The vet put her on estrogen. So, why did the estrogen work for the incontinence? Because estrogen actually increases the elasticity and the little rubber bands around the lower part of the urethra where the urine empties. Yeah. Wow. Elaine says, wow, thanks. But yeah, so, and it completely cleared it up. So yeah, smart vet, right? So how many of women who go to their doctors with that complaint, if they're even brave enough to go, are going to get, oh, you just need some estrogen. Like how many smart doctors are out there that are actually going to do that? But instead, we're either told if you're scared to go to the doctor, then you'll just go to the store and buy the pretty pants or whatever, or the pads. And not to mention, there's a lot of money that's probably made. Yeah, suffered 3 years. Yeah, people suffer. Not to mention, there's a lot of money made off those pads and normalizing that so they can sell all that. So I'm always going, where's the agenda here? Who can benefit from that, right? So I'm going to jump into this and we'll kind of move away from me dogging commercial medicine. And I am a medical doctor and I do deal with this stuff all the time, right? But I'm always looking for the underlying cause and how can we not just treat it, but fix it like that vet, right? And so how do we make people feel like this is safe? And how do we give them comfort that there are things that you can do about it? Because sometimes commercial doctors, I call them, sometimes they'll say, oh, we have to do surgery or we have to medicate you, right? There's lots of medicines that you can give people to slow the urine down, right? Or to help with the frequency. And so frequency is just because, do TSH was 4.6. Okay, we actually did a thyroid talk yesterday, and I think I got it posted, Stacy, or was that Ashwin? I'm not even going to say that name right. So if you'll go back and watch that, and I'm definitely going to do another thyroid talk because there's no way I finished all the content that you can talk about on thyroid. Estrogen, okay, for someone that had cancer. Okay, yeah, so I'm going to jump into this, but I do want to say that a lot of what you get out there in commercial medicine is let's do surgery. And, when I took my family medicine boards, the answer, A, B, C, D, or A, B, and C, whatever it was a lot of this stuff, like if someone has high blood pressure, is lifestyle changes and follow up in 3 months and then medicate, right? That was 25 years ago. But that was the answer. And now, whoever gets told lifestyle changes or hormones or change your diet, no, it's just we get slapped with a pill. So I just want to kind of lead in with that. Okay. So this is what I do every night. And my little tribe that hears me do this all the time, I apologize because you hear my rant all the time. But someone asked the safety of hormones, because we have to have that conversation, because I'm going to talk a lot about the influence of primarily estrogen on the vaginal health. But I want to put you at ease. So we have to talk about this, about the safety of hormones and why people are scared and what the actual situation is, because menopause means absolutely nothing, right? So anybody who knows it in my tribe knows that menopause means nothing. The problem is ovarian failure. And 100% of women will go through ovarian failure. That means you have no ovaries, you have no hormones, and it's scary, and it's the cause of everything that you see in the nursing home. And we need to have a conversation. Okay, I'm going to jump in. Okay, so I love to draw graphs. And on this axis of the graph, I have hormones. And then on this axis is a woman's life cycle from birth to 100. Let's say you live to 100. And then right here in the middle is about the age of 50. And we also have to talk about this little time frame here, which is sometimes as early as 30, but usually it's 35 to 45 to 50. So I'm going to just kind of put 35 to 49, just so it kind of fits on here. And what happens is when you're born and you start having menstrual cycles, I'm just going to draw estrogen just for the convenience of only having to use one color. No, you know what? I love to do this. Wait, I'm going to do this. This is fun. I'm going to use red and green because it's Christmas, right? I'm going to use red and green. And red is going to be estrogen and green is going to be progesterone, because estrogen and progesterone balance each other out. So at birth, let's get a little tricky. At birth, we start with our hormones and they start to increase. Yeah, I'm going to have to do it separate. That's not going to work. And then as it increases, we start having menstrual cycles. So the hormones fluctuate. And then maybe we have babies, or we have PMS, or we have endometriosis or PCOS, hormone issues. And this is our hormone cycle. And then here at 35, we have perimenopause. And then we start kind of getting really erratic. And then we literally bottom out. And so I can put progesterone chasing that. And then progesterone declines too. And why does it decline? Why does it drop off? Is because you were born with all the eggs that you're ever going to have. What is an egg? An egg is something that gets fertilized when you have, I lost my cat. Egg is something that gets fertilized when you have a baby and it pops out of the ovaries every month, and you are predetermined genetically with all the eggs you're ever going to have. You lose about half of your eggs at about the age of 25, and then about the age of 50, you're out of eggs. They're gone, they're done, the basket's empty. And that is when we experience ovarian failure. So the definition of menopause is just a year without periods. Definition of perimenopause is whacked out hormones, because it's like crazy land. So menopause is just a year without periods. What we are dealing with is ovarian failure, a complete flatline. And I was just having a conversation with somebody today about, why is it so bad? Why is this just an epidemic of people with just this rapid aging and this, mental decline, dementia? The stats are I'm trying to remember, I talked about this the other night, but about 40% of women over the age of 55 have mild cognitive impairment, and up to or over 40% have moderate cognitive impairment, meaning brain fog or having problems with their memory. And about 60% have mild cognitive impairment. So that's not okay. I mean, that is really, it's scary, and it's clown world, and it's suffering, and it doesn't have to be. So anyway, okay, let me get back to this. I'll start preaching again, right? I preach every night. Okay, so I want to say, if a 9-year-old girl wants to go on birth control because she's having heavy periods or whatever, a doctor has no problem doing that. And that is synthetic, high dose hormones, but nobody ever says, oh, that'll cause cancer. We can't do that, right? But somehow when you're out here and have nothing, now they're like, that's going to cause cancer. That's just clown world. And if you didn't have a thyroid, no doctor in the world would tell you you can't take thyroid hormone because that'll cause cancer. So you have to say what hormone you're talking about is going to cause cancer. And if you're going to call it estrogen, then you have to ask what kind of estrogen, because there are different kinds of estrogen. And if you're going to call it estrogen, are you talking about synthetic or natural estrogen? Completely different. So that's where we are. And if you think about who gets breast cancer and who gets the diseases of aging, is it the people who have the normal estrogen progesterone levels, or is it women out here? This is where all the diseases happen. So that's just so upside down. Anybody with a brain would be going, wait a minute, what's going on here, right? So I also want to tell you, because this whole talk tonight about bladder health and vaginal health is all about hormones. So I want to kind of preempt this by telling you that there was a study that was done in 2002. So I'm going to put a timeline up here. And the study was done in 2002. And in 2001, about 60% of women were on HRT. And in 2003, it dropped off to about 30%, half. What happened in 2002? There was a study that put out information that was completely misinterpreted. And I have dug into this for years, trust me. And I love you guys. I would not mislead you. I would not mislead my patients. And this is borne out in the almost 25 years that I've been seeing patients. The facts on the experience, not just what I hear or what I read or the studies that I read, this is how the facts play out. So this study, basically what they took to the media was they said, black currant oil. Okay, yeah, that can help. That can help with menopause symptoms, but there's not enough black currant oil in the world to take the place of ovarian failure. So just want to throw that out there. But this study, basically what they took to the media was that 1 in 4 women who take any kind of HRT are going to get breast cancer. And that is not true. And in fact, it has protective effects, because if you come out here and look at what happened in that study in 2002, they took women 10 to 15 years out from menopause, right here about the age of 65, and put them on synthetic estrogen. And they did not have the protective benefits like the women here do of having hormone therapy. So yeah, they're going to have increased risk of heart attacks and strokes and breast cancer. And so they didn't have the protective benefit. But what did they do? They went and they said 1 in 4 women are going to get breast cancer on HRT. And that is just wrong. I don't care who you are, what studies you show me, that is just wrong. Yes, so she says she's on estrogen and progesterone. Absolutely. Estrogen and progesterone balance each other out. So you have to be on both. And that's another conversation. But if your doctor tells you because you've had a hysterectomy that you don't need progesterone, that's like saying you have shoes, you don't need socks. So don't let them do that. You have to have progesterone. Okay, so after 2003, kind of out here to 2024 now, about 5% of women are on HRT. So, and I was reading something today about those stats, about 5% of women being on HRT. And anyone who knows me knows that I always tell you the truth. And when I learn something that is eye-opening or contradictory to something that I know, Sorry to interrupt. I'm sorry I interrupt so much, but I want to make sure I get your questions. You'll have to come back around with that question because I'm going to finish this, but I don't want to miss that question. Okay, so please put that back in the comments. So where was I going with that? So anyway, something that I learned today was that when women get bioidentical hormones, my EMR at my office, when I put patient notes in, if I do a compounded hormone, which I do almost 90% of the time versus, something from a commercial pharmacy, it doesn't get registered in the system. So because we are having more and more awareness of bioidentical hormones, those might not be being registered. So when I say 5%, I want to retract that just a little bit because those are the stats on synthetic hormones. So I can't really speak to on compounded hormones. Somebody would have to go and actually do research in the compounding pharmacies to see what they're getting. Tap your screen, you're watching, give her hearts. Yes. Thank you. If you like what I'm saying, or it's interesting, or you're learning something new, just tap the screen, just tap, and it'll give hearts. Same age, 55. I was too old and didn't need progesterone. Jenny, that's a complete lie. And any doctor who's telling you that is uninformed. So you gotta work with somebody. And that's a good point for me to say, we help with that too. So if you're being lied to and not helped, or you don't feel better, if that's working for you, that's great. But if it's not, we have a test kit. I have to move it here because I didn't flip around. We have a test kit and we can mail this to you, and you can just go on our site, which is Hormone Bliss is our website. And we can mail this to you, and we can do your testing for estrogen, progesterone, and testosterone. Oh, Constantina says she got her test kit. Yay! Oh, yeah, yes. So we can do this. And then one of our hormone experts will get on a Zoom with you and go over your results with you and tell you what's going on. And then the beautiful thing is we can get you on some bioidentical hormones and get you feeling better. And it is customized to you. And we have full-time support for you for adjustments, for knowledge. Knowledge is power for you to understand. So it is amazing. It's my passion project, and it's exciting. So my goal is to have 50% of women, which again, bioidenticals have kind of changed this, right? But 50% of women on some sort of bioidentical hormones. And topical route is safe, effective, and life-saving. That's what I always say. So the way we've set it up to be able to get it to every woman is completely safe. And I would go head to head with any researcher or medical doctor, because I'm a medical doctor too, and I've done my research, and I would go head to head and have a robust debate on that. So Healthy Gal says, I'm very interested, and I'm so glad when I hear that and people talk about bioidenticals. Okay, so you guys, oh yeah, bioidenticals 13 years. That's awesome. You guys, if you have some comments, if you'll just give me about 10 or 15 minutes, I still want to hear your comments. But I'm going to try to get into the meat of what I told you I would talk about tonight, because I don't want somebody to go, oh, you talk about that every time. So if you put a comment in, if you'll give me just a few minutes, I want to come back to that. Okay. So I don't want to miss anybody, because this is all about you. I always joke, this is like my messy brain here. Okay, so new screen, and I'm going to draw, I don't know if you guys are familiar with what pH is, but pH is the acidity or the alkalinity of certain substances, usually liquid substances. And so why is that important? Because pH is very important when we're talking about bladder or vaginal health. Okay, so if we were to put, and pH just stands for potential hydrogens, so you don't have to know that, just a little nerdy organic chemistry. But how many hydrogen molecules are on a solution or a substance, right? Okay, so what we call a balanced or normal pH is 7.0. So anything over here higher is what we call basic or alkaline, and anything down here is acidic. Okay. So acid sounds bad, right? But she says no dryness. Yes. Okay, we're going to talk about that for sure. So the normal pH of the vaginal area is about 3.8 to 4.5. And so why is that important? That's important because yeast and our candida or bacterial vaginosis is usually here at about 4.5. So the closer we get out here to basic, the more you're going to start to have irritation. And I've already talked about how important estrogen is, how safe it is, and how much we need it. So why do we need estrogen? We need estrogen to maintain the pH. And we need estrogen for the muscular structures and the urethra. That's where the urine comes out at the end of the bladder. We need estrogen to help with the collagen of the whole bladder, all the matrix that holds our bladder up so that we don't have incontinence. We need to have healthy urine. And yeah, she says healthy gases keep our brain healthy. Yes, absolutely. And our brain will not be healthy if we're worried about all this stuff too, right? So, okay. Blood is about a pH of 7.4. So sometimes some of the odors that you can get when you have menstruation are because you're getting up here in this basic. And basic or alkaline has an amine structure to it. And an amine is just an organic chemistry. Again, you don't have to know that, but it can have a fishy odor. So when you run into that, that can be problematic, but that odor can tell you that you don't have a healthy urogenital space. Uro meaning urine, genital meaning the whole vaginal area. Okay, so if it's out here, it's not good. Okay, and urine is about 4.8, so urine lies about here, almost there. And sperm is actually a 7, so sperm can actually have that amine smell. And one of the things that we can talk about tonight is douching. And a lot of people do douche after intercourse, and that can be a problem because if it has vinegar, then it can change the acidity, which does help, but it can also kill some of the normal bacteria in the vaginal area. And if that happens, then the flora, just like in the gut flora, it changes, and then the pH can get off with a bacterial infection. So yeast and bacterial vaginosis like Gardnerella lie here at about, what was it? A little higher than 4.5. So yeast and infections lies here. So then that's when you can start to have those basic amine odors. So a couple other things, because sometimes people are like, what causes the vaginal odor? And I just want women to know that it's like, it happens. Is it normal? No. But, menstruating, the blood, that can change. That can have an odor too. Sweating, vaginal secretion alterations, and that can happen with hormone changes too. With estrogen dominance, you can actually get changes in the mucosal lining. Again, I said yeast, candida, STDs, poor hygiene, antibiotics. If you take antibiotics, usually you can have yeast overgrowth, so then that can cause problems too. Smoking, and we know that smoking can actually, it has toxins in it that can cause bladder cancer. So those toxins that affect the bladder also affect the urogenital area. And then UTIs, because that bacteria can smell as well. So I want to kind of show you what the structure of the anatomy is. So we have the kidneys, and that's so bad. Oh my gosh. Okay, I'm gonna make that a little bit better. And then we have the kidneys, and then these are called ureters. This is where the urine is filtered through, and then the urine comes down the ureters. And then we have the bladder, and then the bladder has the urethra, which then exits the urine out of the body. And then the vaginal area is around the ureter there. So we have the vaginal walls there. And when you look up through the vaginal area, you can see the urethra. And so that would look like, when you look through, like in a speculum, when you're looking in a woman's anatomy, the urethra is where the urine comes out here, and then the vaginal vault is there. And then that goes up into the uterus. And then we could draw the uterus here too, but we're just kind of focusing on this area right now. Prednisone, yes. Prednisone is a synthetic steroid, and steroids can absolutely throw things off because the steroids can actually, although they can decrease inflammation, it can throw the pH off because it can throw the bacteria off as well. So, okay, so got that. Let's skip to all the good stuff I want to talk about. So one of the things that I do want to talk about is this has been a game changer. This is PhD. So we're just talking about pH, right? And this is boric acid. So this is fascinating because this is wonderful. And I should have done it before I took my pH scale off. But this is boric acid. So yeah, this is the stuff like you put in your laundry detergent and in your carpets kill fleas. But boric acid is actually a natural substance. And because it's acidic, it will change the acidity of the vaginal area. So even young girls remember the menstrual blood can have that higher pH or stinky or after intercourse. So you can, and do not swallow this. This would be very bad. But if you use it to change the acidity of the vaginal area, this is a game changer. And if you have recurrent UTIs, recurrent vaginosis, recurrent yeast infections, this will take care of it. So you don't have to use it every day, but like I say, maybe after intercourse when that alkalinity is high, or, if you're on menstrual cycles, especially like after, just kind of clean things out. However, it could be risky in someone who's trying to get pregnant because we just don't know. So anytime we don't know if you have a risk of pregnancy, probably wouldn't do it. If you are at that age where you could get pregnant, I would say don't use the vinegar douches, but I would use plain water or aloe vera douches because you don't want to change, you don't want to kill the good bacteria in the vaginal area. But if you're perimenopausal or you have an IUD or, had your tubes tied or something like that, this is a game changer. I had a friend of mine, actually, she had dealt with UTIs for years, and they had to go in there and dilate her ureters because she kept getting backed up infections. And nobody ever said, well, what's the pH of your urine doing all the time? And it was just like, and then she found out about this, and it was a game changer for her. She's like, you changed my life. She was so traumatized by all the urologists over the years who were just doing these surgeries and all this crazy stuff. So, okay. So, okay, so we talked about estrogen decline and pelvic floor muscles, the urethra lining, overactive bladder. What is overactive bladder? Why is it that as we age, you feel like you can't get to the bathroom fast enough? Or why is it that you feel like you got to get up and urinate every hour through the night? Why is it every little bit of water that you drink, you immediately have to go urinate? That is mostly progesterone decline. And also progesterone helps you sleep. So if you're not sleeping, you're getting up going to the bathroom because you're like awake and you're like, oh, I might as well go to the bathroom. So the sphincters are very dependent on progesterone. So estrogen and progesterone balance each other. And that's why when somebody tells me, asks me, do I need progesterone, even though I don't have a uterus? I'm like, you absolutely do, because your bladder health is so important to have progesterone. So the frequency that happens is because the bladder isn't emptying every time. So if we have urine in here, if this is not working properly and you're not emptying, then all of a sudden, now just a little bit of urine in there triggers that fullness. And then you can also have bloating and things like that from estrogen issues, but triggers that to think I have to go to the bathroom again, but you're never really emptying the bladder. And when that happens, you're at a higher risk of bladder infections. And bladder infections can then lead to kidney infections because if the bacteria, this is supposed to be a sterile environment, but if there's bacteria in here and the bacteria goes up the ureters into the kidneys, that can be life-threatening. Kidney infections are nothing to take lightly. And it's really interesting because when I did my geriatrics rounds in residency, and then even after I got out of med school into practice or after residency, the nursing home rounds that we would do, the first thing that we would check for these elderly people when they started having drastic cognitive decline, meaning they were lost, they were confused, or they were, out of it, or they were talking crazy, or you thought it was just dementia overnight, was to check for a bladder infection. And you can ask any doctor, who has done any kind of geriatric rounds, is that true? And it's like, yeah, that's the first thing you check, and you treat them for their bladder infection, and all of a sudden they're okay again. So the cognitive changes that can happen because your bladder is so dependent on, it's so sensitive to infection and to inflammation, that the whole body just lights up. And that infectious load, especially when it gets up to the kidneys, can cause severe cognitive changes. So yeah, not good. So this can be very serious. Okay. So we're talking about incontinence and bladder issues. So how would you treat them? Well, one of the things that happens too is that after menopause, because your metabolism is shot, because you don't have the hormones that you need anymore, like estrogen, to drive your metabolism, and estrogen and thyroid work together. So you absolutely need estrogen to make your thyroid work. So you start gaining weight. The more weight you have pushing on the bladder can then cause more issues with incontinence, because it just pushes the urine out, right? It's that weight is heavy on there. And so some of the things that you can do are pelvic floor exercises. So if you've never heard of an exercise called Kegels, you probably want to write that down, Kegel, and look that up. She says, I'm on 100 milligrams progesterone, but still have the urgency to urinate at night. So I'll go to Kegels in just a second, but I do want to answer that. There is another hormone that's called DDAVP. Won't be a quiz on that, I promise. I always say that because it's just nerdy science. But that hormone actually decreases the urge to urinate throughout the night. So it kicks up. And that's why little kids who wet the bed, their DDAVP is off. And so you can actually give women DDAVP. It's also called vasopressin, and that can help. But what I would probably do is, if you can tolerate it, increase the progesterone to probably 200 milligrams. The problem with that sometimes is it can make you feel a little puffy or bloated, because if you think about a menstrual cycle, estrogen, progesterone during a menstrual cycle, too much progesterone can cause issues too. And some people are really sensitive to progesterone. So, but that is something that might help. And that will usually keep you from waking up. Hmm. Sorry, guys, if you are watching me on the live stream, my TikTok got clipped. So I'm trying to see what happened. So if you are watching me, I'm so sorry. I'm going to try to figure this out just a minute, because this was really good stuff. We were starting to get to a really good point. Let's see what we got. Hey guys, I hope I didn't lose too many of you. I'm so sorry about that. This has been a crazy day. I don't know what happened to my phone. Sometimes I get clipped because I say things that maybe people don't like. So it happens sometimes. Yeah, today has been kind of crazy. Came home and there was an orange thing on my door that said emergency and a number circle from my gas company. And so we chased down, there were like 20 trucks in the whole, oh, thanks, screen's backward. There were 20 trucks in the whole neighborhood. And let's see. So they had to come reconnect our gas. So it's been a little crazy today. So I don't know what's going on. Okay. So I'm back. So I'm sorry if I lost some people. Hopefully, people that were out there were not lost. Oh, Elaine's back. Sorry, Elaine. Sorry, my little tribe. I love you guys. Crazy day. I don't know. Something. Is it full moon? I don't know. Anyway, okay, so I was talking about Kegel exercises, so Kegel. And that is basically something that you can do. And a lot of times, urologists or kidney doctors will send you to do something called biofeedback. And that's where they can use electrodes to measure the current through the bladder walls and the urethra. And they can tell you how to do exercises where they can see what's happening and then retrain you how to tighten those muscles. So Kegels are pretty much, if you can look them up online, but it's pretty much where you, when you're urinating, you can start and stop the flow of your urine. So it's almost like if someone was knocking on the door and they said, "Get out of there," and you had to, like, what do they call it? Pinch it off. So, but you do that. You start and you stop that, and you start and you stop that. And so that's Kegel exercises essentially, or you can go and you can do the biofeedback and where they actually can train you at that. Eating healthy, losing weight, staying hydrated is really important. And the problem is if you have bladder frequency, you don't want to drink all the time because you have to go urinate all the time, and you don't want to drive anywhere because that's an issue. So so staying hydrated really is the best thing though. Okay, so things that can affect all of this would be bladder health, would be hormonal changes, of course. We talked about estrogen decline. Infections can cause urinary frequency. So if you're having a lot of infections, so things like the boric acid can absolutely help. And then if you're taking antibiotics, that can throw things off. If you douche too much, foreign bodies like tampons, those kinds of things. If you're after menopause, then that's probably not an issue. So I want to talk a little bit about things that can affect your bladder health, basically, and the issues that we're talking about. Some are hormone blocking therapies. So especially if you're on anything like tamoxifen or any chemotherapeutic agents, aromatase inhibitors, things like that, that lower your estrogen. I'm not saying stop those. I'm just saying be aware that that could be a problem. Birth control pills. And why birth control pills? Wouldn't you think, well, you need more estrogen? High dose synthetic. Oh, that's kind of creeping me out behind there. It looks like Mr. Krabs on, what is that? SpongeBob? Okay, it's behind me. It was really distracting. Sorry. But birth control is high dose synthetic hormones that actually shut down. The way it keeps you from getting pregnant is it shuts down your ovaries, basically. So you stop producing natural estrogen, which is what keeps the vaginal tissues moisturized and lubricated. So that can happen. Okay, antidepressants, especially something called tricyclic antidepressants like trazodone. And a lot of doctors, they'll put women on trazodone. It's an antidepressant, but the side effect is it makes you sleepy because they won't address that what you're going through is ovarian failure and you don't have hormones anymore. And the gifter badge, Wild Angel. Thank you. Number 6 member on the team. I don't know what that means, but it's really cool when you guys like the roses and diamonds and hearts and the likes and I don't know. It's awesome. So I'm glad you guys are enjoying this content. I'm here every night at 7:00 sharing and telling you crazy things that I hope are just pattern interrupts, right? Industry disruptors, they call it, because you're being lied to. And the truth is freaky sometimes because it's like, I always say it's clown world. So thank you. I'm glad the content is good. Tell your friends. I don't know, maybe, and I promise to be here till after Christmas. So I might switch it to just Monday through Friday after Christmas. I'm even going to be here Christmas Eve. So if you guys are bored or you've like snuck away and you're bored at 7:00, you can hang out with me. Or if you're waiting for Santa to come hang out with me. Okay, so antidepressants and even ones like Prozac, Effexor, Paxil, all of those can cause vaginal dryness. Antihistamine. So if you have chronic allergies and you're taking Benadryl or Claritin or Zyrtec or any of those, decongestants like Sudafed. If you ever had chemotherapy or radiation, especially to the pelvic area, pain meds. If you take chronic pain meds, morphine or oxycodone or hydrocodone, blood pressure medications, because they decrease blood flow to the pelvic area, and things like beta blockers and diuretics. So diuretics actually make you urinate more, and it can dehydrate those tissues. Acne medications, some people aren't aware that things like Retin-A and things like that, or not Retin-A like the face, but Accutane, like if you're taking high dose vitamin A's, antipsychotics, which are just different medications, and so those are just some of the medications that can cause problems. So some solutions would be talk to your doctor about like different medications, or get on some hormones and fix everything, because mood changes and pretty much everything that all these medications, even high blood pressure, can be drastically changed by hormones. And there's so many mechanisms to that, but your metabolism and just losing weight, 5 to 10 pounds, you can get off blood pressure medications. Taking things like magnesium and nutrients that your body's deficient in can help with magnesium or help with blood pressure. And in fact, when I did my OB residency, when we would deliver baby, or the moms would get pregnant, the blood pressure medicines were dangerous to the moms. So you know what we gave them? Magnesium, even magnesium in an IV if it was really high. We didn't use all these beta blockers and stuff because it was dangerous for the baby. So why are they not telling us about magnesium, right? And that's another thing. Magnesium helps with constipation. So if you have a lot of stool in the vault, because the rectal area and the lower part of the colon sit against the bladder, sometimes people will have urinary frequency just because there's bulk pushing against it. And then you think you've emptied your bladder from below, but from above, there's always something pressing on it. So magnesium is wonderful for constipation. I mean, I have so many women tell me, if you never told me anything else, that was a game changer for me. So magnesium's huge. About 30% of women, good night, Constantina. I'll see you tomorrow. About 30% of women who are even on HRT, systemic HRT, which is, usually in my world, it's bioidentical, so it's topical, still need something vaginal. And the difference between topical BHRT creams and vaginal BHRT creams is that it's a different base. So on the skin, it's a much thinner base so that it gets absorbed very quickly into the skin, and it goes systemic through the blood, the small capillaries, through the bloodstream. And that way we are bypassing estrogen going through the liver. And I use a lot of different forms, patches, and sometimes troches or dissolvables under the tongue, but the creams are the absolute safest because it just goes right into the bloodstream, which is why we use the saliva testing, because you can measure what's actually in the cell. Now, I do blood testing in my office as well, but that's more of a measurement if we're using other routes like oral routes or progesterone or something like that. This is really good. And if you can't get a doctor to check your hormones, this is awesome, because we send this to you and you pretty much, this is what we call a saliva test. And this is a extremely reputable system. This company's been around almost 50 years. So sometimes people are like, saliva, what is that? But yeah, it's amazing. It's very, very accurate. I've used this for probably 15 years with patients, and you just fill out this little questionnaire. And sometimes people don't realize all the things that are related to menopause, heart palpitations. We talked about that last night with thyroid stuff. So you might want to go back and watch that live replay. Suze Q says, I'm sending mine on Monday. Yay! Do it tomorrow. Why are you waiting until Monday? Oh, well, tomorrow's Sunday. Okay, never mind. That we've actually had that problem with people who've ordered the kit, and we actually have to call and chase them down. And we're like, you clearly you clearly ordered it for a reason. And we're so loving. We just want to help people, right? We're not like trying to be mean or anything, but we're like, just do this, and it's like, I know, and I'm busy, and I'll get to it. So put it by your bedside when you order the kit and just make it a priority, make you a priority, because so many women just put everybody else first. So getting on some BHRT is got to be your priority, because all of these things are coming for you. 100% of women will experience all of this if they don't do something. I'm not saying we're the only people, but this is my passion project, to help people. Healthy Gal says, contact you. Our website is Hormone Bliss. So just hormonebliss.com. And yeah, so you basically just, the first step is to order a kit, and then you get into our funnel, and then our experts work with you and figure out because everybody's different. So this is always an individualized plan. You are different than anybody else on this feed tonight. And so your dosing will be based on your symptoms and your numbers. And we never treat numbers, we treat people, but it's still important. And some people will tell you, you don't need testing, and that's just stupid. Would you manage somebody's thyroid without testing? You wouldn't. So Chandra says, very interesting. Okay, cool. I'm glad you think so. So, and I always tell people, even if you're on hormones now, but you don't think they're being managed right, the protocols that I have are based on probably 25 years of, maybe even more, because I've been studying hormones. Even in my master's program, I did hormones in my thesis. So yeah, so everything is based on all of my experience over the years. So all of our people are trained. We actually have a training program too. And some people reached out last night, and it's not ready to go to, it's ready. We just haven't figured out a way to make it available to the public. So that's coming soon. So I'm excited about that. But yeah, so, and during Christmas month, my moderator, fiance, wonderful man, had just put that saliva kits, $119. So they're usually $299, so almost $300. But this month for Christmas, they're only $119. So for like $100, you can find out what's going on with you and get your answers. So yeah, so that's awesome. Okay, so I want to finish a few more things on here. We talked about the hormone creams, right? Stocking stuffers. Yeah. Be careful if you're a guy on here, getting that for your wife or girlfriend, because you have to be careful, because, hormones can make us girls crazy. So it's always a little bit touchy when a girl's already sensitive, about mood and stuff, but would be a wonderful gift. And I have a lot of men who've seen my TV show that we have on our local Fox affiliate, but they'll see it and they'll tell their wives, go see her. And so it's a game changer. And then once they come see me, he says, ask politely. Yes, honey, you have to ask everything politely with a menopausal woman. But yeah, so once the women actually come see me, then they'll be like, well, you know what? My guy needs testosterone. So then, then them and the whole family are in. So, they're in family programs and stuff. So it's fun. We get to take care of everybody. So it's a functional medicine clinic too, as well. So a lot of spillover, but everything that you can do all at home. You can do the test kit at home. You send it in. Our experts work with you through telehealth. And so it's easy, and it's amazing. So it's a passion project, and I really feel like it was on my heart. It's just a God thing, because I've seen the changes. And when you have a woman who is completely like the lights are out, and then you see her at the next appointment, and I always tell my nurses, I'm like, do not judge those women the first time they come in, because they might be completely flatlined, and you're thinking, how are we going to help this person? I mean, she's just, like there's nothing there, no substance. Or they might be bitchy and they're like, meh, I'm like, do not judge them their first time, because they will be completely different. I promise you, when they get on therapy and come back. And that's been true 100% of the time. And I always tell my women that we might not get it right the first time, but if you stay the course, because everybody's different, we always get it right 100% of the time, because everyone's different, and not everybody, we get it right the first time, but we always get it right because that's our commitment is we stay the course with you. So as long as you're willing to make the adjustments and do the things, and yeah, if you want to lose weight, we have, meal plans and all those things we can do for you, but just get feeling better first. I mean, we're never going to say you got to go exercise and you got to eat all this right stuff. I mean, you should see the way I eat sometimes, and I'm not preaching to be unhealthy, but as long as you have your hormones balanced, your metabolism is going to be on track. So you can't eat everything in the world, and the bad habits, but in moderation, when you have the hormones of a 30-year-old, you can eat the pasta, you can eat the cake, and it's okay. So yeah, so that's my preaching there just a little bit, but I'm more concerned about every day that you don't feel good is a day you can't give back. So, Healthy Gal says, not been balanced in almost 2 years. And that's just criminal. That's terrible. I mean, no woman should have to know her hormones aren't balanced and live like that. So that's icky, I like to say. Okay, so we talked about boric acid. Okay, so probiotics, I want to talk about that just a little bit. I know we're almost up on our hour. So the main healthy bacteria, because we have healthy and problematic bacteria, both in our gut and also in our vaginal flora. So there's bacteria in there all the time. You do not want that bacteria, if the bad bacteria win over, or the yeast, to go up into the urethra, into the bladder, because then you get infections. And that's one of the reasons why we teach little girls to wipe from front to back, because you don't want to bring the rectal or the vaginal bacteria up into the urethra, which is why I drew that picture a while ago where the urethra sits. So that's just geography, basically. So lactobacillus is the main pH, and you can actually get vaginal probiotics, like the suppositories, like the boric acid, and you can also take oral probiotics, and there are specific ones for lactobacillus for vaginal health. So there's a company I like called Metagenics, and when you come into our program, we can help you with all that too, and we can create plans with vaginal probiotics or whatever you need, and it's all individualized. So if you're wondering, well, what do I take? What supplements do I take? We help you with all that too. So you don't spin your wheels and waste your time and money trying to figure out what it is that you need. Okay. So vaginal probiotics, vaginal suppositories with probiotics, probiotic enriched feminine products, and there are some washes and wipes out there. Anytime you take an antibiotic, please, please, please take probiotics. You're just a sitting duck. And almost every time I have to do an antibiotic with a patient, we will do a diflucan because the yeast and the bacteria are always there, and they're always just kind of kindly, but potentially at war with each other at any moment. So if I'm going to wipe out all the bacteria, essentially, not all of it, and the yeast aren't affected by the antibiotic, they're going to go nuts and have a party. So usually if it's a really strong antibiotic, ask your doctor for a yeast medicine, diflucan, something like that, and start taking, they're saying I'm almost running out of time. Sorry about that. And take probiotics like all the time, but especially when I'm really sensitive to probiotics because the gut flora, we did the talk on leaky gut and gut the other night, but the gut flora are tricky, and your serotonin is made in your gut. So I love this. So if you go to our site is Hormone Bliss, you can see this, but shop Hormone Bliss is our store for our e-commerce. And this is the fruits and greens. So you also get fruits and greens, but this has probiotics and prebiotics, meaning the fiber that the good bacteria feed off of. So this is good stuff, and it tastes yummy, and it's just a shake, and it's really good. Okay, so I think that's everything. I hope I got to your questions. If I didn't, you can email me at drtammy@drtammytucker.com. That's one of the ways you can find us. You can do info@hormonebliss.com, and you can DM me here either on Facebook or on TikTok or Instagram. I'm on all the things. I have tons of videos on my YouTube site. which is Dr. Tammy Tucker is my YouTube site. So you can go watch lots of education on there. My TV show is The Naked Doctor Show, the naked truth about health and lifestyle and wellness. So, but yeah, so you Google that. That's a little interesting, but I promise it's PG rated. But I talk about clown world and how this is all upside down and the things that you need to know and the truth about things because you are being lied to. And they'll probably kick me off just for saying that. But but the truth about a headache is not an aspirin deficiency. Your problems, the things they're telling you you're just getting older, your frozen shoulder, your headaches, your back pain. I am 55. I have been on BHRT since I was perimenopausal. I do not hurt anywhere. I feel wonderful. I sleep great. I don't have hot flashes. I don't have frozen shoulder. I don't have neuropathy. I'm just like, I'm in my 30s. I have the hormones of a 30-year-old, and I want woman who is an ovarian failure, which is what the problem is. It's not menopause. It's just a year without periods. But in ovarian failure, I want every woman to have the opportunity to have safe, life-changing and life-saving BHRT. So anyway, that's my rant for the night. Don't forget, kits are on hormonebliss.com. And if you go to my link in bio on TikTok, I have a link and it goes to my link tree and there's tons of educational stuff. And I had my link as my website, but we changed it to the link tree. So if you want hair loss information, if you want thyroid information, if you want HRT information, I've got all these freebies and I'll just like throw all the information at you. My free ebook, Balancing Act. And my newest book has just finished its last round with my editor, and it's called The Menopause Metabolism Reset. And it is amazing. Even my editor, she's like 82, and she's like, I so wish I'd known this like earlier. She's just like, this is, and she's like one of my best friends. So I think she would tell me I'm amazing. But to really say that she wished she'd known that sooner was really impactful for me. So okay, I'm going to go 2 minutes over. I'm here every night at 7. So please tell your friends, come join. You guys can DM me and tell me ideas that you want me to talk about. I'm doing the 25 days of Advent till Christmas, and we're getting close. But I have a topic every night. But I want to answer your questions. So bring your questions. And if you need anything, oh gosh, I'll be back. Yay, I love it. So 7 o'clock every night, I'm here unless something weird happens. But yeah, come visit me. Tell your friends. And any way I can help or serve. I just love you guys. I hope you have a wonderful evening, and I'll see you tomorrow. Mwah.